don't have to be generating a lot of heat. Of course, if it is already inordinately hot, we want to keep them cool. We want to keep them at a comfortable temperature so their body is not stressed by trying to control temperature on top of everything else. The reason there is so much overlap between internal bleeding and shock is that when you have massive external bleeding, the source of shock and the onset of shock is pretty obvious. But when you have internal bleeding, it can often be very hidden and occulted. If somebody takes a fall that causes a rupture or a cut, bleeding from an internal organ, then the control room manager can be losing their pressure without any sign to you. So, okay, you want to be alert for the signs of shock. If you detect shock, or if there's been an accident of sufficient importance, significant seriousness, make sure you call 911, 999, your emergency medical services, so that they can address shock directly. Okay. If you have any questions about this, do be sure, about this or anything else, please be sure to send an email or engage in the chat widgets on various pages on the lower right hand side. There are instructors available to help clarify. We really want to make sure that you understand these things clearly. Okay, if someone does is in shock and you're waiting for emergency medical services, remember it's a progressive condition. It is a process, not an event. So you want to be sure to monitor them and make sure that their airway remains clear, that they continue to breathe properly, and that their situation does not become one of emergency breathing or CPR. Okay, let us go to the next slide, which is low responsiveness, what to know and what to do. Really, really simple. There we go. And it is, by the way, the last slide. We've gotten to the end. If an adult, or if anybody, is acting drowsy, confused, dizzy, the really easiest way, if you've ever seen someone intoxicated or inebriated, if someone is acting like they're under the influence of a medication or alcohol or drugs, and you know that they are not, okay, this is a co-worker at work or someone that you've been with, and they start to have difficulty speaking or speak in a strange way, they have difficulty breathing or breathe in a strange way, have difficulty balancing, then something's going on. Something bad is happening with the control room manager and with their circulation to the brain. Now, it can either be a problem of circulation, it can be a problem of how much oxygen is going on, or it can be a problem of something chemical in the circulation. In any case, you have a serious situation, and it should be attended to by medical personnel. So if it's got sudden onset, you may want to call in your emergency medical response, or take them to care. For just one moment, let's talk about taking someone to care. If you have a simple injury, it may be that your workplace has a policy that someone will be driven to the emergency room rather than calling 911. Do not be the only person with a victim, if possible. Try to have two people. Try to make sure that the victim is in the back seat with an attendant or someone who can take care of their needs so that you can focus on driving. If you are in a potential heart attack situation, I don't recommend driving yourselves. I seriously recommend that you call 911, because an ambulance unit is kind of like a small emergency room. They've got equipment, personnel, and capacity that we can't come close to in our own vehicles. So I recommend not doing your own transport in any circumstance. If your policy is that you must, in some circumstances, try to have a second person with you to attend to the needs of the victim while you focus exclusively on driving. Okay. If you have any questions or concerns, please do send us email or widget, and we will be happy to help you. I hope this has made a difference for you, and I hope that someday, should you ever need this, you now have the tools you need to figure out what to do in a situation. Okay. Thank you.